I want to explain a little bit about the private HMO insurers. Of course we know what HMO stands for. Hand the money over. We know that insurance companies are middlemen that don't provide a health care service. This is why we have to cut out the insurance company middlemen. The insurance companies operate much like banks. They pool people's premiums. And then they put it in a reserve fund. The profits, that is. And they invest it in the stock market. And hoard the profits in the reserve fund. So, quickly want to mention the excesses of our private insurers here in Minnesota. You care. Excess profit reserve, $66 million. Health partners. Excess profit reserve, $143 million. Blue Plus. Excess, $113 million. Medica. Excess, $240 million. And the biggest of all in excess is Blue Cross. 1 billion with a B. All this excess profit should be going to people's health care.
I'm Tom. And I haven't had health insurance since I was 18 years old. I've been working and not unemployed. Between doctor visits and prescriptions, I've racked up a medical bill. About a year ago, I was diagnosed with a treatable cancer. Between all the visits and ultrasounds, the surgeries and the follow-up checkups, I am now officially over $150,000 in medical debt at 25 years old.
I'm over $150,000 in medical debt at 25 years old.
I'm being forced to file for bankruptcy. She's going to ruin my credit for the next 7 years. I'm being threatened to have the wages that I make garnished. I don't make enough to get assistance, but too much to afford to get my own health care.
I don't make enough to get assistance, but too much to afford to get health care.
Thank you.
Thank you.
62% of bankruptcies are because of medical debt. And that makes me mad. It's not right for any one of those people to have bankruptcies. Because of medical costs. And not only that, 77%